Hello, good morning or good afternoon, everyone. My name is Dr. Hind Safran, and I'm an R3 resident from the Kuwait Board of Ophthalmology. It's my pleasure to be presenting this case today, and I hope it meets the program's expectations. Pardon me, I got a sore throat just last night, so I hope I don't, lose my voice in the middle. So the title, as the doctor already introduced, is it a subperiosteal abscess or hematoma? So this was a 13-year-old boy. He's a known case of Bernard-Soulier syndrome, which is an inherited coagulopathy, a giant platelet disorder, which was stable, and he was, following up with his hematologist. He presented to our eye casualty, with rapidly progressive, painful right eye proptosis, lid swelling, mucopurulent discharge, and deterioration of vision that started upon waking up in the morning. So it was explosive onset, just over a few hours. There was no history of preceding trauma. He denied history of any Valsalva maneuvers. But one day prior to his eye complaint, he did go to the general practitioner who had diagnosed and treated him as a case of sinusitis. So on examination, his vision was, right eye vision was counting fingers up to 2 meters, but the patient was visibly distressed. It could have been a little better. Left eye was totally normal. On exam, the right eye had lid swelling and partial mechanical ptosis, restricted ocular motility, frozen globe dystopia inferomedially. The pupils were normal, negative RAPD, conjunctival chemosis, mild SPEs, and otherwise normal exam. He was febrile upon admission. So these are the pertinent labs. He had leukocytosis. Platelets were normal, but the peripheral blood smear showed large-sized platelets, so it's a functional abnormality in coagulation. And the coagulation profile was all somewhat high, but not too high. This was the plain CT of the brain, orbits, and paranasal sinuses. The parents refused a contrast CT. We would have preferred a contrast CT. And this CT shows an extraconal hyperdense heterogeneous lesion in the superior lateral aspect of the right orbit, as you can see. It was compressing the optic nerve, and there was complete bilateral opacification of the sinuses. So the question was, is this a subperiosteal abscess or a non-traumatic subperiosteal hematoma, or a combination of both? Okay, so I have less than a minute. We admitted the patient, and we treated him as a case of orbital cellulitis, decided to wait till tomorrow and see how he was doing. The next day, there were no signs of improvement. The vision deteriorated. He had worsening pain, and there was a positive RAPD. So everything started to be urgent. We urgently consulted the hematologist to prepare him for surgery, for surgical evacuation. Meanwhile, they were preparing him with platelets and plasma. We did a repeat CT with contrast, and it confirmed an increasing mass that looked like a hematoma. So we did the surgical intervention. There was no intraoperative bleeding or complications, thankfully. And the next day, there was significant improvement, negative RAPD, and on discharge, his vision didn't, recover 20/20, but he had some remnant exposure and some Dellin effect, which could cause some corneal astigmatism. So this was the case in discussion. This is the first
time
case.
is up, I'm sorry.
Okay.
The discussion.
Thank you very much.
Is there any specific question you want to ask the panel, or do you want just some comments?
I'm not sure how it's supposed to go, so...
Maybe we should ask for some comments, if that's okay.
Sure.
So first of all, do you have any more details about the surgery that was performed? Because one of the things that we have to consider that the blood in the hematoma was increasing over the time.
Yes.
So that means that there was kind of feeding vessel that was that was feeding the hematoma and increasing inside.
Yes.
So I was wondering during the surgery if there was any...
There was a gush of blood.
Exactly. Any
Active
cauterization
bleeding.
of that, or any use of any sclerosing therapy for that? Because
No, we applied a drain.
It will recur, and the expectation is that it might recur, and sometimes can produce even intraoperatively severe bleeding.
Mm-hmm.
that's one of the tricky part of this case.
Yeah,
Thank you
yeah.
for sharing with us.
Yeah, I'd like to just comment, in general, non-traumatic subperiosteal hematomas have been reported in the literature. And so sometimes we need to keep it in the back of our mind. This was masked by orbital cellulitis. So we weren't sure, should we wait? Because he also has a coagulation disorder. We don't want to rush him to surgery and, end up with some bleeding we can't control. But the treatment in general of a non-traumatic subperiosteal hematoma is conservative.
Right.
But in this case, because he was deteriorating, there's active bleeding, so you have to take him for surgical intervention.
I think, from
Yeah.
my standpoint, I think the abscess wasn't an odd, if it were an abscess, it was in an odd spot.
Yeah.
I couldn't see the frontal sinus to see if there was any frontal sinusitis.
Yeah,
at all.
I couldn't put all the images due
Sometimes
to the
if there's
time.
frontal sinusitis, you
Total,
can get these
total
lateral.
opacification of the
Okay.
frontal sinus.
So sometimes you can get these relatively lateral abscesses, superior lateral abscesses with frontal sinusitis.
yeah.
Regardless, though, I think surgical intervention, even if it
Yeah.
were one or the other, was
Yeah.
indicated just
Yeah.
because of the way things were going.
In general, the learning points is to differentiate, a hematoma and an abscess, usually by location. It's more superior with the hematoma, more medial in an abscess. Explosive onset, you should think more of a hematoma. And keep in mind with the history, he has a coagulopathy. The literature also reports Valsalva maneuvers, which he might have had and denied because he was coughing and sneezing due to the sinusitis. So that was a challenging case for us at Al-Bahar. And I'd like to thank the co-authors. We published this in the American Society of Ophthalmic Plastic and Reconstructive Surgery for anybody who wants to have a look at the details and the references. Thank you, everyone.